Hi, good day. My name is Bernard, MPS student, University of New England. Environmental Health 722, the final project presentation. Drinking water is essential for human existence. Continued monitoring and surveillance is important for detection, prevention, and treatment of any contaminant, for sustained supply of drinking water, and maintenance of health and the environment. Environmental impacts. Sources of environmental impacts include clay particles, disaster storms, floods, heavy torrential rain, deforestation. Application of aluminium to clear turbidity advised. Resistant protozoa, examples Giardia lamblia and Cryptosporum pardon. Use of filtration avoidance agreement and boiling water protocols. Also, use of iodine or chlorination will eradicate the above. Urban contamination. Urban contamination could result as a result of constructions, drilling, manufacturing, and domestic wastewater leakage. Surveillance, regulations, and domestic wastewater control system will control this. Establishment of emergency monitoring units will also help to reduce this urban contamination. Health impact. Gastrointestinal diseases could result from water contamination. An example of those are cholera, diarrhea, and amoebiasis. We could also equally get anemia, lead poisoning, hearing difficulties, hearing loss, and growth retardation, especially in children. Other continued health impacts include renal diseases, cardiovascular diseases, and reproductive diseases, especially among adults. Adequate medical treatment protocols is advised. Observing lead control measures, increase in surveillance and monitoring to identify isolated cases and treat accordingly. Identifying incidents with recordings and reporting for complete data information. Protecting sources of drinking water is very paramount and important. Recommendations. The use of aluminium for purification of turbidity is recommended. Adherence to filtration avoidance agreement, which I emphasized in my interview with the New York State Region 3 EPA officer Daniel C. Agostino. Other recommendations include observing boiling water procedures, disinfection of water with chlorine or iodine, regulatory compliance, identification of contaminants from the source, and treatment as appropriate. Emergency response team in cases where there is water leakage of the distributing system to have adequate emergency response team that will address the immediate emergency and get it remedied. Household waste control measures. This is controlled collection of waste products from the house in containers that are covered, which will be delivered to the moving vehicles that will come and pick it up and then to the dumping sites recommended by the state and APA. Pollution control measures application is equally advised. Lead control measures enforcement is also recommended. Random monitoring and testing is also very important. Control the use of herbs and insect chemical killers, especially among distributing system, among the reservoirs, among where the water treatment centers are located, will help to control the chemical effects of these insecticides or herbicides. Drinking water sources, reservoirs, and distribution protection is very, very important in maintaining the above recommendations. Voluntary residence monitoring says, what I mean by that, I mean that residents will volunteer for training to show them how to monitor their water, how to test their water, and if there is any problems, contaminant, they will send it to the central station for evaluation. Operational performance and distribution monitoring units should be established. Disease outbreak control, monitoring and rapid treatment team is advised. Follow up and rehabilitation is very, very necessary. Closing remark. The above recommendations are important for the maintenance and sustained supply of high-quality drinking water to millions of New Yorkers and visitors, and development of this policy for implementation, if approved, will guarantee provision of quality drinking water in New York City. Thank you, Bernard.